Dr. Brandon.
Hey, Dr. Morgentaler, what's going on?
Here we are again.
Yes.
It's another episode, exciting episode of the Sex Doctors podcast.
It is.
Yeah. And I understand we have a good question today.
It was a good question. She said, my husband and I enjoy your show. Why don't you give us more sex tips? Something like that. That's not a direct
tips.
quote, but
yeah.
I thought
Okay.
that's fair. That's a fair question, or that's a fair request.
Well, you are a sex therapist.
That's right. So,
but I think people misunderstand what a sex therapist is.
Before we start, a small disclaimer. The Sex Doctors podcast is not a substitute for medical or psychological advice.
Yeah, I think they think that. I mean, I know that you can answer this question. You probably have a lot of sex tips, but I'm not sure that the average sex therapist is all into how do you do lovemaking. Are they?
I don't know. I would think so.
Okay. All right. Well, I stand corrected then.
I don't know.
And
I
my apologies to all sex therapists.
So, but I don't know. I don't
there.
talk about that with the sex therapist. So I don't know.
Right. Okay. All right. So what tips do you have?
So, at the gym today, this concept was brought up by somebody else, and I thought, that's a good one. That's a good one to talk
What do you
about.
mean at the gym? You want to like clarify? I mean, do I need to be there monitoring?
No, it's all good. It's all good. But
do you need a chaperone? You need a chaperone?
No. I didn't bring it up.
I think what you're saying is you have conversations with your trainer or whoever else. Yes.
Yes. People talk. Whatever. Okay. They know you're a sex therapist. They want to talk sex.
Oh, right.
It's fine with me.
There you go.
Whatever. So the discussion was something called the Coital Alignment Technique. And this is a technique that was developed or suggested probably a couple decades ago now, and it didn't ever get much press, but it's essentially a way to have sex, heterosexual sex, that gives the woman more opportunity to have an orgasm during thrusting. The concept is, without getting too into the weeds with this, that the way the clitoris is on her body, the exterior part of the clitoris that we see, it doesn't get stimulation automatically when a man is thrusting the way like they thrust in porn. So, these sort of deep thrusts, all the way out stuff.
Uh-huh.
Okay, so to access the external clitoris, what that would mean is he would lay directly on top of her. There wouldn't be like their bellies would touch, okay? And instead of these deep thrusts, he would sort of rapidly move his body over top hers such that he would be constantly stimulating her clit while he was thrusting. So
I'm taking notes here. Because the bodies are in contact in the vicinity of the clitoris. Is that right?
So essentially, on the inside her vagina, the head of his penis is sort of in the vicinity of the interior clit, but on the outside, his belly or whatever it is rubbing on her exterior clit. So it's sort of like a dual
it
action.
helps for the guy to have a little bit extra belly? Is that what
No,
you're saying?
I don't. That research wasn't done. It's a great question, though.
Yeah.
But they did research in MRIs. I remember when I first became a sex.
I could see the scientific research question, right? Does abdominal obesity improve
the odds
female responsiveness?
Right. Because there's more weight there, and there's more
contact.
Right,
maybe.
more contact.
Yeah.
Well, so that
Coital alignment.
Yeah, coital alignment technique, CAT, C-A-T.
Wow.
But so it's about not deep thrust. Enter and then move up and down over her clit. So these
Very
are not
interesting.
deep.
Very interesting.
Right. Okay.
And it's good?
Well, I think people will have different experiences of it, but the folks who developed this.
Yeah. I would make one. I would say to our listeners, your mileage may vary.
It's good.
But try it.
Yeah, try
it.
Let us know how it goes.
First, I've heard of this, but like I say, I've taken notes.
Okay.
Yeah.
So that's my sex tip. What's yours?
Yeah. So, I hear a lot from couples that the women often complain that the men are just in their own head. that yes, they're having sex together, but the woman sometimes feels like she's almost less than an accessory to the crime.
I hear that a lot too.
Yeah. So, it's funny because on the one hand, you and I talk a lot about how sex is this magical, it's like the magic sauce in a relationship. But there are a lot of people who are having bad sex out there. And one of the main issues is that there's a lack of connection. And so what I would say to the guys, this is more of a guy thing than a female thing, is that the guys need to register their presence and their connectedness. And what do I mean by that? It means they can't just go into their head. They have to somehow say something to their partner they're having sex with, or maybe it's a look. I would say one of the best things they can do is in the middle of sex or at the beginning of sex is to say something complimentary. And it can be like, it can't be fake, but it could be something like, you look hot, you look great, right? I want you. There's something about you, not just that I'm going to stick my
Your junk
somewhere, right? And I think that's a big thing. It's about who people are and how they show up, rather than exactly what it is that they do.
This is so nice. I think we're going to do more sex tips. I think it's good.
Oh, good.
Okay.
I'm so glad you like it.
Yeah. So, okay.
Anyway, that's my tip.
That's a great tip.
Now,
I have to tell you, as I already said, though, but I hear that so much in my practice.
Yeah.
So I think that that's a really valuable thing. And I would say, even if you feel like you don't do that, try it anyway. Even if you feel like you're not guilty of this problem, still see if you can amp it up a little bit more and see if you get a different reaction from your partner. Because sometimes we don't realize what we're putting out there. So
Okay. You know what? I've had reactions from guys who say, it's really going to be hard for me to find some, like their marriages are bad. Sometimes sex is bad. Sometimes they've been married for a long time and they may have trouble finding something, they say, to say complimentary. And that's not, I would say it's not true. It's not true.
Yeah.
Because all they feel is their resentment sometimes. And what it reminds me of, we're going way off topic, but I remember when I was a intern in surgery, or a junior resident, and I was rotating through Children's Hospital, and I was with a pediatric general surgeon, and in the middle of surgery, it was evening or late afternoon, a kid came to his office, and he asked me to scrub out and go see what it was, and he had a hernia. And I don't know, the kid was like 10. And the goal was to try and you can do something called reduce a hernia. You can actually, it's a bulge, and you can gently try and get it to come back in. And so I did my best, and I wasn't successful, and I came back into the operating room to report. And this was Dr. Arnold Kolodny, one of the greats at Children's Hospital. And he asked me what I said to the kid before I did anything. I said, I don't know what you mean. He says, well, did you give him a compliment? I said, no. He said, you know, you're asking them to trust you and like you. And the easiest way to do that is to say something nice to them. And I said, well, what if I can't think of anything? He says, you can always find something nice to say to them.
That's so
he
sweet.
says, if nothing else, you can like their shoes. I like your shoes. And they relax and do that. And if you can do that for kids you don't know, then you can do it for somebody that you care for or that you've been in a long-term relationship with or whatever, right? There's always something. Yeah.
Okay.
Yeah. Now, I wanted to talk today about something that I personally find very interesting, which is about whether or not we need to really monitor carefully estrogen levels in men who are on testosterone and do something about it if the estrogen level is high. And the reason I find it interesting is that many of my colleagues, I've been in conversations recently about this, many of my colleagues think this is absolutely essential.
Yeah.
That you can't let the estrogen level get too high. You got to keep it down.
I feel like it's getting more popular, like this concept of estrogen in men and keep it low or whatever.
Controlling estrogen.
I hear more and more about this.
And the reason it's interesting to me is that there's no scientific evidence to suggest that it's an important thing to do. It's actually kind of amazing.
This is so Abe Morgentaler right now.
And I'm not saying it's wrong, but so just to be clear, so the idea is that if estrogen level, so when people go on testosterone, some of it gets converted to estrogen. Mm-hmm. And so estrogen levels can rise above the normal range. And my own personal belief is in the vast majority of cases, it doesn't matter at all. Mm-hmm. But I measure estradiol levels. Estradiol is the primary form of estrogen in the body. But I started measuring it because probably 20 years ago, 15, 20 years ago, a lot of people started going to these clinics where they were crazed about estrogen levels. And so my patients who knew something, and maybe they'd seen somewhere else, so they always wanted to know what their estrogen level was. So when we'd go over there at testosterone results. So I said, I better look into this. And my fellow and I wrote a paper on it. We looked into it. And there are some groups out there that, these testosterone type practices that will automatically give a medicine called an aromatase inhibitor. The usual one is an Estradiol that blocks the conversion of testosterone to estradiol. So it lowers estradiol. And they'll do it for every single man. And some of my colleagues, undoubtedly experts in their own right, who now do it either routinely or if the estradiol level rises above the normal range, even in people who have no symptoms from it. And when I say no symptoms, the only real symptom that we know of for sure that's related to higher estrogen is called gynecomastia, or swelling of one or more breasts. And the reason is men can have breast glands too, and they can respond to estrogen just like women do around puberty with growth of the breasts. So guys don't like that, and so those are the guys, if that happens, that no matter what their estrogen level is, we give an aromatase inhibitor, we lower their estrogen, and they'll usually get better. Or we even stop the testosterone for a while, let them get better, and then when they're ready, we restart testosterone together with this thing. But my colleagues, many of them, not all, do this routinely. And what's funny to me is some of these people are on guideline committees. They're publishing and writing recommendations about how to do it.
Oh, they're all very evidence-based.
They're all evidence-based, and there is no evidence.
How then did this get started? Because I hear this even from an international population. Like, this isn't just a USA thing. Like, docs all over the world are doing this.
Yeah.
So then how did it get started?
So I think it happened, hard to know for sure, but I think it happened from sort of the alternative medicine world, and from which has a lot of people who are doing either bodybuilding or they love their muscles.
Right.
Okay?
Yeah.
Like more muscle is better health and all this. And there's a population, including the bodybuilders, and others, that are very body aware.
Yeah.
And so if you ask people, like some of my colleagues, about why do you do this to somebody who doesn't have breast tenderness or swelling, they say, well, it reduces bloating. So what's bloating? So you usually hear about women with bloating, but it usually has to do with fluid retention, right?
Well, testosterone causes that, doesn't it? Or is this
testosterone does cause a little bit of fluid retention.
Yeah.
And in some of the older guys, they can get a little swelling in their feet.
Right.
And if it's somebody that goes on the scale regularly, they'll notice that especially if they're on injections, which levels rise and then they fall, they'll notice within a couple of days of the injection or getting pellets that their weight goes up.
Yeah.
Magically by a few pounds. And by the end of the cycle, when the testosterone declines, their weight goes back to where it was. So there's some fluid retention from testosterone, which you can attribute, I suppose, maybe it's from estradiol.
Yeah.
Or maybe it's from testosterone.
There's been no research, is what you're saying.
But in the younger guys, we rarely see this.
Is that what you're
And,
saying? We
yeah,
just simply don't know how to understand it. Is that what you're saying?
Yeah. So I'll tell you a funny thing. So for people who are listening, so normal estrogen levels, estradiol levels, depends a little bit on the lab, but it's roughly 20 to 40 picograms per mil.
Okay.
Okay. There's one publication by some esteemed colleagues where they wrote about their management style, and if it goes above 60, they'll start an aromatase inhibitor. But we'll see patients, I've seen patients in my practice easily who get to 70 or even 80 and are completely asymptomatic, and their testosterone works great. So, and so I asked my newest friend in the LLM world, which is Claude.
Yeah.
I'm somewhere between ChatGPT and Claude these days.
Yeah.
And I asked Claude, what's the evidence that having an elevated estradiol causes fluid retention? It says, well, it actually volunteered this fact to me first, and then I pushed back, what's the evidence? It says, well, actually, there's not a lot of evidence, but it's written about a lot. It's certainly written about in the bodybuilding community with online forums and internet stuff.
Yeah.
And I said, well, where's that come from? It says, well, it's known that in women, estrogen can cause bloating. For example, in women during pregnancy, they get a lot of edema. I say, okay, so what are the levels of estradiol in pregnant women? So guess what? So remember, in men, it's like between 20 and 40, 30 to 50, something like that.
Yeah.
In women in pregnancy, it goes into the thousands.
Yeah.
Okay?
Yeah.
Into the thousands.
Yeah.
So women's levels during pregnancy are something like 500 times what it is in a man. Okay? So how much does a 15 or 20% increase, elevation in estradiol really matter? And the answer is we don't know. Now, here's the point. Keeping estradiol low can also be harmful. Well, it can be harmful and can interfere with benefits. What do I mean by harmful? One of the most important things estradiol does in men is it helps with bone density.
Yes.
So it's been shown both in men and in women that if they're on too much, if their estradiol goes too low with these medications, their bone density goes down, leading to osteopenia,
This is problematic
osteoporosis,
for sure.
potential fractures.
Yeah.
Right?
Wow.
Yeah, and we've talked about this in a previous study. One of the best classic studies about how testosterone works was by this guy named Joel Finkelstein, who did this randomized control trial. A few hundred, I think it was 200 men in each of the groups. One group, everybody got medicine to lower their own production of testosterone, so they didn't make their own. Okay, and then he gave back testosterone at different doses. But the key was that half of the study group got an aromatase inhibitor, the one that we use clinically, so they made almost no estradiol. And as you would predict, sex drive and different things change when the guys have no testosterone. And then as the testosterone gets replaced, different things like sex drive comes back and back and back. And at the highest doses of testosterone, it's back to normal. Okay, back to where it was.
Yeah.
But not the guys who had their estrogen blocked.
You're kidding.
And the conclusion of that, what does that mean? It suggests that we need a certain amount of estradiol for us to get our full amount of libido.
Well, that's noteworthy.
Right? The other thing where it made a big difference was also how much fat mass they have. So testosterone helps to reduce fat mass, especially in the belly, visceral obesity. And the guys who had their estrogen blocked didn't get rid of all the fat mass like the guys who had an equivalent dose of testosterone.
It's like the opposite of what these folks would have expected.
Right. So the weird, some of this stuff happens, I think, just because of ignorance and oversimplification. We've thought historically as if estrogen and testosterone are opposites, and they duke it out. Estrogen is for women, testosterone is for men. It just ain't so, right? So women have more testosterone than they have estrogen. Whoa, what?
I know, that's crazy.
More testosterone than they have estrogen. And men need estrogen, which is coming from testosterone, for some of the benefits of testosterone.
So I'm wondering then if it could be a placebo effect if a man feels like lowering his estrogen, reduced his bloating or whatever else. I guess it could be placebo that could be carrying this myth on. Or I guess we can't call it a myth. We just don't know. Is that accurate?
So listen, it's possible.
Yeah,
It's
yeah.
possible. Here's what I can tell you is that every randomized control study looking at the effects of testosterone, maybe with the exception of the one that I just talked about, because that was really that wasn't treating men who had low testosterone. That was trying to figure out how it works, the physiology of it. Those were healthy volunteers. But all the randomized controlled studies in men who have low testosterone, none of them manage estrogen. Like estrogen goes to wherever it's going to go.
Yeah.
Not one of them gives something to keep the estrogen down. And so we have no evidence, really, no good evidence, that it's better in any way.
That's so interesting. I wish someone would do a study on that.
Now, it is possible that anecdotally or for some patients it might be better. But here's where I think it also gets funny, is that a lot of the people who, the bodybuilders, for example, the reason I think that they may be, in fact, correct, almost none of those people are getting testosterone into the normal range. They're on massive amounts of testosterone.
Okay. Oh, that makes total sense.
Or other agents that are like testosterone.
Right.
Like they usually do multiple agents. It's called stacking.
Yeah.
And they can get testosterone levels that are equivalent of 20 times the upper limit of normal.
Yeah.
Which means that their estrogens may also go up to
makes
massive,
sense.
massive places.
Oh, Dr. Morgentaler, I love how you think.
Oh, Dr. Brandon, I'm so glad that you like it. We should do this more often.
Let's do a
It feels
podcast.
almost like, I don't know, foreplay. Mental foreplay. So, those men who are bodybuilders may be exactly right that they need to be on this stuff. And you know what? A lot of the docs see bodybuilders or see former bodybuilders. They all believe, and maybe it's true, that they know more about these anabolic steroids than doctors do. But usually they're not talking about testosterone itself. They're talking about these other regimens that go together. And so the doctors start saying, okay, well, if these very sophisticated guys who seem to know more about this than I do are doing it, maybe that's the right way to go. All I can tell you is that there are only a handful of individuals that I've treated over the years where I really thought that lowering estradiol might help them symptomatically. And sometimes it helped and sometimes it didn't. And the one clear exception is the people with breast swelling or gynecomastia or nipple sensitivity, which by itself is not that common either. And I just don't think it's necessary in most people.
There you have it.
I'm willing to be persuaded otherwise, but man, somebody's going to have to show me some data.
Yeah. Show me the data.
Show me some data. Isn't that interesting? Yeah.
It is very interesting,
in the meantime,
actually.
So the funniest thing to me is that a lot of these people are the folks who are the experts and who always say, we have to follow the evidence.
Yeah.
Right?
Right.
If the evidence isn't there, I'm not going to believe it.
Right.
And here we are, there's no evidence, but that's what they do.
Fascinating. Love it.
Yeah. Well, Dr. Brandon, guess what?
We've come to the close of another podcast.
Another episode of the Sex Doctors. And
for
our viewers and listeners who don't want to miss another moment of this exciting, exhilarating content, what should they do?
We would invite them to go to our website, thesexdoctorspodcast.com, and subscribe. Yeah.
Yeah, that way you'll get all of our, you'll get notices of all our episodes as they appear.
Right.
And Listen, we love you. There's a place for you to comment.
Yep.
Write your questions. We love receiving those. We love seeing what what's going on in your minds.
Yeah.
And give us some feedback.
Yeah.
And I guess that's it for today.
Okay.
And so with that, we bid you adieu.